What is depression and how does it affect us? Depression, a term we often hear, yet it remains misunderstood by many, is a common but serious mood disorder. This isn't just about feeling down or blue for a few days. It's not merely a sign of personal weakness or a condition one can just snap out of. Depression is far more complex and all-encompassing than that. Depression fundamentally changes the way one feels, thinks, and deals with daily activities. It impedes our ability to work, sleep, study, eat, and enjoy life. It's like a persistent cloud of gloom that hovers, making even the simplest tasks seem like herculean challenges. It's also important to note that depression is different from regular sadness or grief, which are natural responses to life's ups and downs. Depression is more intense, lasts longer, and can often occur without a clear reason. Now that we know what depression is, let's delve into the different types of depression. First, let's discuss clinical depression. This term signifies that a medical professional has diagnosed you with depression. It's not just a case of the blues or a brief period of sadness, it's a persistent feeling of despair that can interfere with your daily life. The intensity can vary. A doctor may classify it as mild, moderate, or severe, depending on the impact it has on your ability to function. It's important to note that even a mild episode can be distressing and shouldn't be dismissed. With clinical depression, you might find yourself feeling hopeless, losing interest in things you once enjoyed, or struggling with fatigue, sleep problems, and other physical symptoms. These experiences are not signs of weakness or something you can just snap out of. Clinical depression is a serious condition that requires professional help. Next, we have recurrent depressive disorder. This form of depression is characterized by the occurrence of at least 2 depressive episodes. These episodes are not a simple case of the blues. Rather, they're periods of persistent low mood and loss of interest or pleasure in activities, accompanied by a range of other symptoms such as fatigue, difficulty in concentration, and changes in appetite or sleep. These episodes can be classified as mild, moderate, or severe, depending on the intensity of the symptoms and the degree to which they disrupt daily life. Importantly, intervals of at least 2 months without significant depressive symptoms must occur between episodes for a diagnosis of recurrent depressive disorder. This condition can be a challenging one, navigating through a cycle of highs and lows. But remember, recurrent depressive disorder can be a challenging condition, but with the right help, it can be managed. Moving on to reactive depression. This form of depression is often a response to a significant stressor or traumatic event in one's life. It's not uncommon for life's difficult moments, like a divorce, a job loss, or financial worries, to trigger this type of depression. You see, our brains are wired to react to stress. But sometimes, the stress response can become overwhelming, leading to feelings of sadness, hopelessness, and a loss of interest or pleasure in activities. And that's when we enter the realm of reactive depression. It's important to note that reactive depression isn't just a case of feeling down due to life's ups and downs. It's a serious mental health condition that can interfere with daily life and requires professional attention. So, while it's natural to feel down after a tough event, if these feelings persist or worsen, it may be reactive depression. Remember, reactive depression is a response to stress, but it is still a serious condition that needs professional attention. Now, let's talk about dysthymia and cyclothymia. Dysthymia, also sometimes referred to as persistent depressive disorder or chronic depression, is a unique type of depression. Unlike the episodic nature of many depressive disorders, dysthymia is characterized by a continuous mild depression that lasts for over 2 years. That's right. Imagine experiencing an undercurrent of low mood, loss of interest in daily activities, and general dissatisfaction for more than 700 days. It's a long-term struggle, and because of its chronic nature, people with dysthymia might feel like their symptoms are just part of their personality or character, rather than a treatable condition. Now, moving on to cyclothymia. This is a condition where you experience persistent and unstable moods. It's a bit like being on a roller coaster that never stops. You may have periods of depression and periods of elation, but the highs and lows are not as extreme as those seen in bipolar disorder. It's a subtle and often misunderstood condition. People with cyclothymia might not even realize they have a mood disorder because their mood swings can be mistaken for normal ups and downs. So, what does this mean for those living with dysthymia or cyclothymia? It means life can be a bit more challenging. It can be tough to maintain relationships, hold down a job, or even enjoy life's simple pleasures. But it's important to remember that these conditions are not a life sentence. they are manageable with the right treatment. Treatment options for dysthymia and cyclothymia may include psychotherapy, medications, lifestyle changes, or a combination of these. Cognitive behavioral therapy, for instance, can help individuals identify and change negative thought patterns that contribute to their depression. Antidepressants can help correct chemical imbalances in the brain, and lifestyle changes like regular exercise, a healthy diet, and adequate sleep can also play a crucial role in managing these conditions. Both these conditions can be hard to diagnose, but are manageable with the right treatment. It's about understanding the nature of these conditions and seeking help when you need it. Remember, it's okay to ask for help. You're not alone in this journey. Let's discuss manic depression and psychotic depression. Manic depression, now more commonly known as bipolar disorder, is a mental health condition characterized by extreme mood swings that include emotional highs or mania, and lows or depression. During a manic phase, an individual might feel overly happy, energetic, or unusually irritable. They may also engage in risky behaviors, such as excessive spending or reckless driving. On the other hand, during a depressive phase, they might feel sad, hopeless, or lose interest in most activities. Sleep problems are also common during both phases. It's important to note that bipolar disorder is not the same as depression, but people with this disorder do experience periods of depression. Now let's turn our attention to psychotic depression. This is a severe form of depression where an individual experiences hallucinations or delusions. Hallucinations involve sensing things that aren't real, like hearing voices, seeing things, or even smelling, tasting, or feeling things that don't exist. Delusions, on the other hand, involve holding on to false beliefs, despite evidence to the contrary. For instance, a person might believe they have committed a crime when they haven't, or that they're being watched or followed. These symptoms of psychosis can be extremely distressing and confusing for the individual experiencing them, and can make their depression more debilitating. Both manic depression and psychotic depression are serious mental health conditions that can significantly affect a person's daily life, relationships, and physical health. They require immediate professional intervention. Treatment usually involves a combination of medication, psychotherapy, and lifestyle changes. In some cases, hospitalization may be necessary, particularly if there's a risk of harm to oneself or others. It's crucial to remember that there's no shame in having these conditions or any form of depression, and seeking help is the first step towards recovery. These are severe forms of depression and require immediate professional intervention. Next, we'll look at prenatal and postnatal depression. Prenatal and postnatal depression are types of depression that can occur in relation to pregnancy and childbirth. Prenatal depression, also known as antenatal depression, occurs during pregnancy. This isn't just the occasional bout of tears or mood swings, but a persistent feeling of sadness, anxiety, or emptiness that can make it difficult for the expecting mother to function. Symptoms of prenatal depression can include persistent sadness, difficulty concentrating, sleeping too much or too little, loss of interest in activities that used to be enjoyable, and recurring thoughts of death or suicide. It can be triggered by various factors such as hormonal changes, the stress of impending parenthood, or existing mental health conditions. On the other hand, postnatal depression occurs after becoming a parent. This can affect both men and women, and it's not just the baby blues, which is a common, short-lived feeling of being overwhelmed, weepy, or irritable that many new mothers experience in the first week or two after childbirth. Postnatal depression is a more serious condition that can start anytime in the first year after childbirth. Symptoms can include a persistent feeling of sadness, lack of enjoyment in life or in the baby, difficulty sleeping or sleeping excessively, feeling unable to look after the baby, and frightening thoughts such as self-harm or harm to the baby. Both prenatal and postnatal depression are serious conditions that need medical attention. They can have a significant impact on the mother's health and well-being, and they can also affect the baby's development and the family's dynamics. Treatment can involve a combination of self-care practices like good nutrition and exercise, psychotherapy, and medication. Support from loved ones and professional help is crucial in managing these types of depression. It's important to seek help if you're experiencing any of these symptoms during or after pregnancy. Remember, you're not alone and help is available. Reaching out to a healthcare provider is the first step to getting the help you need and deserve. Finally, let's discuss seasonal affective disorder, or SAD. This is a type of depression that's related to changes in seasons or weather. The seasonal in the name is quite explanatory. It's a condition where certain individuals find their mood and energy levels fluctuating with the changing seasons. Now you might be thinking, don't we all feel a little sluggish when it's cold and dark outside? And while it's true that many of us might feel a bit down during the gloomy winter months, for those with SAD, the change in seasons can bring about a significant shift in their mental well-being. The symptoms of SAD typically start in the fall and continue into the winter months, sapping energy and making one feel moody. In some cases, SAD can cause depression in the spring or early summer, but that's less common. Imagine feeling perfectly fine for most of the year, but as soon as the leaves start to fall or the snow begins to descend, you're overcome by a sense of despair. It's like a switch flips in your brain, plunging you into a state of depression. You might find yourself oversleeping, experiencing changes in appetite, particularly craving foods high in carbohydrates, and having difficulty concentrating. The exact cause of SAD isn't known, but it's often linked to reduced exposure to sunlight, which can upset your biological clock and lead to decreased levels of serotonin, a brain chemical that affects mood. But here's the thing, just because SAD is seasonal, it doesn't mean it's any less serious than other forms of depression. It's more than just winter blues. This condition can interfere with daily functioning and can lead to serious complications if left untreated, like social withdrawal, school or work problems, or even suicidal thoughts. So if you or someone you know seems to be in the grip of this seasonal depression, don't simply brush it off as a phase. Reach out to a healthcare professional. There's no need to tough it out on your own. Remember, even if your depression is seasonal, it's still serious and needs professional attention. After learning about the different types of depression, let's discuss how it's treated. The good news is that depression, in all its forms, is highly treatable. A combination of therapy, medication, and lifestyle changes typically forms the cornerstone of treatment. Let's start with therapy. Cognitive behavioral therapy, or CBT, is a common form of therapy used to treat depression. It helps individuals identify and change negative thought patterns that lead to depressive feelings. Another type of therapy is interpersonal therapy, which focuses on improving a person's relationships and social interactions to reduce depressive symptoms. Medication is another fundamental pillar in treating depression. Antidepressants work by balancing chemicals in your brain that affect mood and emotions. These medications can help improve symptoms like sadness, hopelessness, lack of energy, difficulty sleeping, and lack of interest in activities. It's crucial to remember that all medications come with potential side effects, and it's important to discuss these with your healthcare provider. Electroconvulsive therapy, or ECT, is another treatment option, typically used for severe depression that hasn't responded to other treatments. Despite some negative portrayals in the media, ECT is a safe and effective treatment that involves sending small electric currents through the brain to trigger a brief seizure, changing the brain's chemistry to reverse symptoms of depression. Let's not forget lifestyle changes. Regular physical activity and a healthy diet can significantly influence our mood and energy levels. Other beneficial lifestyle changes include adequate sleep, reducing alcohol intake, and quitting smoking. Mindfulness and relaxation techniques, such as yoga, meditation, and deep breathing exercises, can also help manage depression symptoms. It's also worth noting that treatment for depression isn't one size fits all. What works for one person might not work for another. It's a process of trial and error, and it requires patience, resilience, and a supportive network of healthcare providers, family, and friends. In conclusion, depression is more than just feeling sad or going through a tough time. It's a serious mental health condition that requires understanding, treatment, and support. But remember, it's treatable. If you or someone you know is dealing with depression, reach out to a mental health professional. They can provide a proper diagnosis and guide you towards the treatments that are most likely to work for you. Depression is a serious condition, but with the right help and support, it can be managed. If you or someone you know is struggling, don't hesitate to reach out to a mental health professional.